Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Assalamualaikum. Jiayanu, Pakhera, Galeni, Hao, Chunashumme, Washmale. Ohio Gonzalez, Guten Morgen, Hola, Bonjour, Privyet, Kaifa hal? Halishuba Chatore, Ahlan Wasalan, Marhaba, Buna, Mucho Gracias, Swabi, Bali Kare Aya. Hoş geldin and Ayasayo, Khuyamora, Chivatochi, Haljot, Kalimera, Khairutan, and a very warm welcome to everybody who's tuned into PTV World and watching World this morning. Alongside my very well-learned colleague who happens to be Ms. Hajar Satti. I happen to be Shahzad Hassan Khan, and we hope and pray that everybody out there is ready to kickstart their day with us. But first things first, hello Haja, Assalamu Alaikum. How are you feeling today?
Walaikum Assalam. Thank you so much, Jazakallah Khair, for introducing me. Since it's Monday, it is the start of the new weekend. Over the weekend, it was a very politically heavy and I would say a hot weekend because there were lots of conversation, lots of drawing room conversations, and across the country, there were lots of political conversations going on. But Shahzad, there is one thing. So since it's 12th of February and it's almost, one feels that, we are transitioning towards the spring, right? Because the intensity of the coldness has decreased, especially after the rain, and we are witnessing that it's very pleasant sort of an evenings going on. Especially if you go and if you are driving in the afternoon, so you would feel the effects of the intense sunlight going on, right?
True.
And living in Islamabad, we really did not expected such sort of a weather, although this is the effects of the climate change, the abnormalities of that and the fallacies of the climatic patterns. But my mother was talking and she was saying that when we were young, we used to go to the schools, and in the April we used to wearing the blazers and coats because it was so much cold, right? But now in February we are witnessing that same sort of temperature. So we are also waiting for the Ramadan to come again, Alhamdulillah. And we hope and pray that we have a good Ramadan, a pleasant Ramadan, and not a very, very hot, extremely where the weather temperatures are breaking their records. But apart from that, again, spring is the best time to enjoy the Islamabad because Islamabad is very pretty, it's very clean, it's very green, it has a very abundant forest cover, although because of these mushrooming housing societies we are witnessing a decline in that forest cover, but still it's way more better than a lot of other cosmopolitan cities of Islamabad.
Exactly, and thank you so much Hajar for saying that, because this new place that we are moving to, you're more than welcome, the entire team, and you will feel that there's this forest cover, there are hills around it as well. You can certainly enjoy the spring, but not just that. There was a very different phenomenon which I experienced after a longer period of time, that today while I was in my bed, so imagine that my mother came upstairs to wake me up, and I was like, okay, can you please wake me up? I don't do that usually because I'm not that sort of a person. The kind of books I read will always motivate me to be like a 6 a.m. or a 5 a.m. club member as well. But today it was different because the weather is opened up a little and it's not that cold, and while you're under your quilt, your sleep is more of a very sweet sleep. And this is the phenomena that I experienced today. I was like, yaar, यहीं पड़ा रहता हूँ, कितना मजा आ रहा है ना सिर्फ. So I was up, I wasn't really asleep, but I was like, yaar, it's just so enjoyable. But later on, obviously, then, my kids came in and they were like, Daddy, aren't you going to go to work? And I was like, baby, yes, I'm going to go to work. So here we are, ladies and gentlemen, with a bit of sweet sleep. I don't know whether I wanted more of it or not, but finally we are here because that's what we do. But today, where you mentioned that it's 12th of February, it's a very important day. Because, ladies and gentlemen, today we're going to talk about an illness or a disease. We still have to kind of classify whether, how do we refer to it? Whether it's acquired, whether it's by birth or not. Because on 12th of February, ladies and gentlemen, it happens to be the International Day for Epilepsy, which happens to be the second, actually, Monday of the month February. But while we're at it, Ajay, there are a couple of things which I wrote down for people who are out there. So it's because of the annual raising initiatives that International Bureau of Epilepsy and International League Against Epilepsy come together, and they have two demands. So what they want to do is that World Health Organization came up with a 10-year plan, the intersectoral global agenda, on what we really global action plan. So what they said was that by year 2031 there should be more coverage for people who are living with epilepsy, more than 80%, and next they said that there needs to be more legislation for it. We will talk about it, the legislation part of it, but since we have the medical experts over here, so we really need to know about this illness. There's a lot of stigma attached, whether women who've got epilepsy, should they get married or not, whether they should get pregnant or not, whether a person with epilepsy can drive or not. So with all of these questions, whether it's treatable or not, ladies and gentlemen, we're very lucky that we've been joined by a wonderful guest over here, all the way from Maroof International Hospital. Happens to be a specialist epilepsy and neuromuscular disorders. He is Dr. Yasir Mahmood Malik. Hello, sir. Assalamu alaikum. Good morning. How are you doing today?
Well, thank you so much. Thanks for the nice intro, and I'm doing well.
Thank you
Right, so
much,
Dr.
sir.
Saab, let's start with this particular, is it a condition like Shahzad mentioned, or is it a disease? And explain us about it, and whether it can be acquired or it is by birth. So what is epilepsy?
Thank you. It is in fact a disease. Rather, I would call it a syndrome.
Okay.
Syndrome is a complex word. When the disease goes into the complexity, we call it syndrome. Why is that? Because epilepsy, along with it, contains a lot of stress, a lot of social stigmas, a lot of suffering for not only the patient, whole the family, with a lot of complications related to epilepsy itself and related to its medications. So I would call it a syndrome. But stigma about epilepsy, should treat the patient. We should not be scared from the patients.
Right.
We should not be scared from the disease itself. We should not make it a social stigma. It's a treatable thing. They should live a normal life. We should treat the patient as a normal human being,
Right.
and not something abnormal or not something which we should
But
keep
Dr.
away
Saab,
and not to
if
touch upon.
someone is diagnosed with the epilepsy, or in other words, I think in a layman term we call it fits, right? So how to approach that person with a more sensitive approach that is or inclusive and guarantees the basic human rights to that particular person who is undergoing through this syndrome or disease or whatever you call that?
Okay, I would. There are two approaches. First, I would tell you about the social general approach.
Yep.
With the general population. What they should do?
Okay.
So, if you see a patient seizing, I mean, patient is having a fit.
Right.
You should always put the patient down on the earth,
Okay.
or put the patient on the bed in a left lateral position. I mean, turn the patient to one side.
Okay.
Give open airway. I mean, don't crowd around the patient.
Okay.
If there is a fan, you should run the fan. If not, it's not too much cold.
So there needs to be more air.
They
Do
should-
not suffocate
yeah,
him. or
exactly.
her.
He should not be suffocating.
Right.
There should be good oxygenation of the brain.
Right.
Secondly, if the patient vomits out, that should go down. So you should have put the head in down lateral position. If you are comfortable, you can put some plastic spoon into the denture of the patient so that the air should not go back
Okay.
and occlude the airway of the patient.
Okay.
So the tongue should be forward and it should be compressed down. You should be open the denture. Don't try to put your finger, that can be damaged. And the second approach is to immediately take to the doctor for
Right.
what the doctor should do. For the first seizure, usually we don't treat the patient. I mean, we should give an abortive therapy
Right.
at the moment so that the seizure should go away. We should work up, we should do certain investigations to look what is the cause of the seizures. Sometimes these are the provoked seizures, sometimes these are unprovoked seizures, sometimes there is underlying pathology in the blood or in the brain. We should look for that. If there is existing pathology, then we should treat for the long term. If not, then we should just do some precautions
Yeah.
and wait for the
So
second
let's
seizure.
classify in between provoked and unprovoked as well. So for that, because
Yes.
our sole purpose is to raise awareness. So first of all, let's get going
Yeah.
with the provoked ones.
Yeah, provoked seizures we detect based on the history and some investigations.
Right.
We should make sure patient slept well last night or not.
Okay.
Did patient take any new medicine? Because there are certain medicines who can increase the risk of seizures. Did patient have any fever or infection recently or these
Right.
days?
Right.
And in the blood, is there low sodium level, low glucose level, low magnesium level? These
Sir.
things. And if on CT scan, if there is some hemorrhage or some stroke or some infection in the brain. So these all are causes of the provoked seizures.
Okay. And when we
If
talk
these
about
are not
unprovoked-
there, if the means
There's
on
no
the
reason.
history, there is no fever, slept well, there is no new medicines, patient is quite healthy, there was a seizure by chance, and we do all the blood investigations and the brain investigation, and these all are negative. So that means it was unprovoked seizures. Unprovoked seizures, sometimes we can wait for the next one. We just reassure the patient, tell them to take certain precautions, and then send the patient home. They should feel relaxed and they should feel normal. Just observe certain precautions.
All right.
And if
What are
there's
those precautions?
precautions are like you should sleep well, at least for the young 7 to 8 hours a day.
Okay.
For the elderly 6 to 7 hours a day.
Okay.
You should be physically relaxed and mentally relaxed. Medicines, whenever you're taking new medicine, suppose if you're having a cold, common cold or flu, you're going to the doctor close by, you should tell the doctor that I had a seizure previously.
Okay.
So that doctor should take care of this thing, and doctor should not prescribe that medicine, which can lead you to another seizure. So these are precautions.
And sir, now when
And
we
infections also.
So
to be prevented.
obviously, and because we are talking about provoked seizures as well. So we've spoken about how infections can certainly be a reason, and there can be other multiple reasons for you to get seizures. Now imagine that, that this is something that we are talking about, daytime, when there are people around you. God forbid, if you're ill, if you're going through or you're suffering through any illness, you were sleeping, can you get a seizure during your sleep as well? And what do you think a patient can do while they're having seizures? When
Yeah,
if no one is around, right?
Yeah, there are certain epilepsies which happens exclusively at night.
Okay.
So you can have a seizure, obviously. So first of all, we tell the family to, if there is first seizure, of course they would not know anything. I would still say they should put the patient in left lateral position or maybe right lateral, any of them is fine. And aeration should be good, ventilation should be good, and there should be vomiters outside, or try to open the denture with a plastic flexible spoon. That's all. For the second, suppose first year has happened. For the next year, we tell the patient to be careful, make the patient calm, relax, should be having good sleep at night. There should not be hard objects around the bed. Suppose if he's having a seizure, he can bang his arm or leg with the railings or or wall or anywhere alongside the bed.
Right.
And I always tell my patients, because everybody is carrying a video camera these days in the mobile, so I always tell my patients to record a video. It would be very easy for me to identify whether it's a true seizure or not.
Okay.
So the treatment would be based on that video.
So what do we mean by a true seizure? So that people can classify it as well.
Yeah, that's very good. Because many of the times, especially in the youngs, we see fake seizures, pseudo seizures. If they have seen some videos on YouTube, or if some of the family members having epilepsy, or if they have heard about the seizure, they would pretend like seizure for some secondary gain. Actually, there is no seizure, they would pretend like that.
Okay.
So we have to differentiate that. That is called pseudo seizure, or in the common term, you can say fake seizure.
Right.
We have to differentiate between the true seizure, and because see, if there is a patient with epilepsy, I'm going to start a medicine for epilepsy on that patient.
Sure.
And that would continue maybe lifelong or maybe many years.
Right.
And if the patient is actually not having seizure and I'm starting that medicine,
Right.
it's unfair with the patient, right?
So can't there be any test, with which we can actually check whether the person is epileptic or not? Any run-ups, anything that with which the doctors can actually
during
see?
seizures, you should look how are the eyes. Most of the time in a true seizure, eyes are open. They are either uprolled or deviated to the right or left, or they are open. So you should check whether the eyes are closed or not. If the eyes are closed, you should try to open the eyes. If the patient is forcefully closing the eyes, not letting you open the eyes, it means patient is pretending.
Yeah, so
Secondary gain.
Yeah.
So that means that you can identify it just by looking at the condition. So there is no other test like that. But Dr. Saab, now let's discuss the role of diet in that, particularly when a person is going through an epilepsy. And what sort of a diet would you recommend that would make him?
You will be surprised with my answer, because this is the only disease where high cholesterol diet is favorable.
Okay.
So the patients with epilepsy, but initially we don't tell to the patient that take high cholesterol. If the medicines have failed, then we tell them that go on ketogenic diet. Ketogenic means the diet that contains high cholesterol, like beef, like butter, cheese, cream, these things. So they would favor the control of epilepsy.
So, but then unfortunately,
you have to control the weight.
There can be other pathological disorders.
Exactly. You have to take the things are like that. You have to manage all the things.
And then you have to exercise as well. Would you recommend exercise for person who's epileptic? Probably not lifting weights, but going out for a walk or swimming.
General exercise for the walking, for the jogging, at least 15 to 20 minutes or maybe half an hour a day, it's acceptable for that, provided they're not getting a lot of tiredness.
And I think walking and jogging is recommended because of the fact, unfortunately, if you're swimming and you get a fit, that's going to be a difficult situation.
No, there is another thing I certainly need to tell you, that we ask all the patients of epilepsy not to swim or not to swim alone.
Okay.
There should be a person standing by who can swim, who can rescue you during a seizure.
True.
Suppose if he's having uncontrolled seizures and he seizes during the swimming, there can be a life-threatening situation. So there should be a rescue person alongside that, number one. Number two, working for the epileptic patients, driving, working at heights, working near fire, working near heavy machinery or sharp objects. These are totally not recommended.
Okay.
And let's, Dr. Saab, also discuss, because we have the paucity of the time, the social stigma, the taboo surrounding this disease, right? So if you have patients who are epileptic, what do you recommend to them? And especially, I think doctor is also a healer, so he's also counseling at the same time. So what sort of recommendation or advices you dole out to their family members in order to, so that they should be more sensitive to someone who is an
Exactly.
epileptic patient?
We should always take the epileptic patient as a normal person.
Okay.
He is allowed to live a normal life like
Okay.
me and you are living.
True.
For the young ladies, they should be marrying normally. They should be going through pregnancy and lactation normally. They should be sticking to the medicine, not missing the medicines, and always observing the precautions to prevent a seizure. Otherwise, they should live a normal life. Their profession should be modified in a way that they should not be, as I told before, should not be driving, should not be working close to height, close to fires, heavy machinery, sharp objects,
Right.
or at heights. Profession wise, they should be modified, otherwise they should be living a normal life.
Exactly. But sir, in addition to this, there are multiple questions which we need to ask, and that is that, for example, if we are talking about a lady who is going to get married, she was epileptic, you said that it's absolutely fine for her to do that and to get pregnant as well. Do you think that this illness is actually inherit? You can inherit such a disease because of your genes as well, number one. Number two, God forbid, if the mother is getting seizures while she is pregnant, do you think that there is going to be an impact on the baby as well? Not by a fall or something, but just by having a seizure?
Yeah. It's a very good question. In fact, it's a wonderful question. See, there are two types of epilepsies. One is genetic, that is inherited, and second is acquired during the life. So, inherited ones are genetic syndromes. They exist and they are in the families from one to other. And certainly, they can be there in the from mother to the fetus, children also. For that, usually we tell, if there is a syndrome in the family running and we know 2 or 3 people who are having that, we recommend the people to not get married within the family. It should be outside the family. That is better. Number one. Number two would be whether there is impact, your question number 2, whether it would be impact of the seizure on the baby or not. There is certainly an impact. When the mother is seizing, during that, mother doesn't get enough blood to the brain, to the womb, and there would be no sufficient blood supply to the fetus. There can be reduced, or there can be breakage of the arteries supplying blood to the fetus. So the fetus can have reduced growth intrauterine, or fetus can have reduced mental activity later on after the birth.
And this is one thing that we are discussing from the perspective of the mother, gets a seizure and whether there's going to be an impact on the baby or not. But imagine that a person who's already epileptic, do you think that it's very advisable for them to get pregnant? Because otherwise it can be harmful for the mother too then.
Yeah. See, despite of this disease, they have to live a normal life.
True.
They have to get pregnant. We cannot say them not to get pregnant.
Obviously.
But there are certain precautions they should observe before that. What are these? Like they should visit their doctor before getting pregnant.
All right.
They should tell the doctor that, doctor, I am planning for a baby.
Yep.
So doctor should modify their medicine. There are certain medicines who are safe during pregnancy, and certain medicines who are not. The doctor should switch the medicine to the one that is safer in pregnancy. And during pregnancy, as the weight is gaining, as the baby, mother is gaining the baby, the water in the tummy.
Yep.
So there is the level of the medicine which was there before, which was effective for the mother. Now it's not effective anymore, because weight is more, there is dilution of the drug.
True.
So we have to increase the dose of that medicine.
True.
So
it's
that
just
should
like,
be managed
for
by the
example, how I weigh probably 90 kgs, so the doctor will always ask me, okay, how much do you weigh? Then he is going to give me an antibiotic, okay, yaar, take 1 mg, twice a day, so it totally depends on that, and that's understandable.
Exactly.
But in addition to this, Dr. Saab, now we live in a country where we have a lot of stigmas. Now imagine that, we grew up where we never knew that, okay, fits was something or epilepsy is something. Imagine that there were times when people would say, isko chappal sunga do, isko pyaz sunga do, things like that. And we have grown up with these things. So can you please list a few what people might do which is literally stupid to do to a person who's getting epileptic fits?
Acha, I have worked most of the time in Islamabad. Before I was working in Lahore also. Islamabad people are very much educated, or they are close to educated people, so they are not doing these blunders anymore.
Thank you. Yeah.
Myths are gone now, but still in the past they used to do that. Social stigmas and these things.
Peer Baba
Peer Baba, they would not consider that it's epilepsy sometimes. This happens here.
Okay.
They would say this is jinn only.
Right.
Yeah,
Many of the people who are under treatment, still they would say, doctor, what do you suggest? Should we visit a Peer Baba also?
Yeah.
Maybe there is a jinn here. So these are the
what do you
problems
say
that-
then?
To these people, I say, okay, you can go, because I cannot breach their religious concepts. So
True.
I would say, okay, you take there, but you don't miss my medicine, please.
Okay, yeah.
Okay.
Continue both things together, it will work.
I think it's always a mix of both as well and a combination. But
yeah.
it's a humble request. Obviously, we're not denying
Yeah.
that this cannot happen. You see, this is something.
You know,
Yes, sir,
sorry,
please.
sorry. You know, our people are very much religious. You cannot breach these concepts.
Yep.
So you cannot change their concepts also. So better you modify your saying in the way that they.
But sir, obviously, I mean the Western medicine, because the one that you have been studying and the one that there is a lot of research going on, it usually deals with the symptoms, right? And it tries to deal with the symptoms and then try to find a solution. But there are certain diseases that are diseases of soul, and then they manifest in your body, right? So as a doctor and as someone who is a practicing Muslim, how do you recommend, I mean, integrating both of these approaches, the Western medicine approach and also the Islamic approach?
Religious
Because there is a
healers,
hadith that except for the death, every disease has a solution, every disease has a cure out there, right? So
Exactly.
how do you approach or tell those people, especially who have a strong religious beliefs, because obviously...
And what we really need to kind of highlight over here is it's the soul's manifestation of getting you to that point where you're getting ill.
Right.
You know, so it's not more of a biological thing, but more of a
Exactly.
Because your body is very intelligent.
More-
If you're going undergoing through some, very important thing, the body is always telling you, it is always signaling you that there's something wrong in that, right?
Body is
you
your
need to-
thermometer then.
Yes,
True,
you
true.
need to listen to your body, and body will give you answers
Sure.
out there.
See, most of the psychiatric illnesses, these are related to the soul.
Right.
And these are most of the time healed with these religious healers or counseling, or these psychologists also doing
therapy,
counseling
yes,
only,
yes.
therapies. So such diseases mainly psychiatrists are dealing, but still sometimes patients who are coming to me, they're having blend of the diseases. They're having psychiatric illness also, and epilepsy or the other diseases also.
True. Because
So-
you mentioned psychological
Exactly.
stress as a one of the
So for those, definitely alongside the medicine, I would do the counseling. And for the religious, your question, first half of your question, for the religious, of course, I would not breach their concepts, religious concepts. I cannot change their concepts.
Right.
So I would modify my ideology like that. You please don't miss my medicine.
Exactly.
And you can make dua. You can take him to the P. There is no problem. So they would do that. They would listen that.
So-
And I would counsel religious point of also.
So, but then there's going to be two more questions, sir, and it's because of the fact that certainly people who are actually living with people who are epileptic, I think it's for their awareness as well. Number one, because you've worked abroad as well. You were in UAE for 10 years. You were in Lahore. Now you're in Islamabad. 2021 you joined Maroof International Hospital, coming from Dubai as well. So with different regions and geography, there will certainly be different problems. Did you ever come across a person or a patient who was getting fits but wasn't epileptic? It was something else. Did you ever come across that?
Many.
So many. So that we
Many of them.
actually support our narrative that there can be issues with your soul as well, and how Allah actually keeps on telling us that if you remember me, I'll give you the peace of heart.
In fact, if we go to the research studies, 30% of the people who are having true epilepsy, they are having blend of 30% of them are having blend of true plus fake seers.
Okay.
And 30% of who are being treated by the psychiatrists, who are having only psychiatric illnesses, they are also having 30% of them are also having true seers.
Okay.
So we need to be very much particular about
Careful,
picking
yeah.
these things, taking history, giving time to the patients, then investigating and listening to each and everything mildly. In fact, in my mobile, still few videos exist. I tell the patients to make a video and send me.
Yeah.
I could show you, but of course I don't have.
अम्मी पूरी झूठ बोलते हैं, पकड़ लिया आपने, चुप करके
Yeah,
फिट डाल दिया
many
आपने,
fits,
तो
many
मसला बन
fits,
गया.
fake fits.
Right.
And we have to pick them by video, and we have to. It's difficult to assure the family that it's not a true seer.
Yeah.
Family is not listening there. No, doctor, we cannot live without this treatment. How can we leave the patient? I would tell, okay, you give, these are attention gaining skills. You give less attention to such
He's going to be fine. Or she's
such
gonna be fine.
particular dramas or whatever you say. Please don't give attention. Patient would be better. No, doctor, how can we leave that?
Exactly, because as a parent you certainly cannot do that. Na? You cannot bring your heart to a conclusion that okay, my kid is actually doing it that way. You will never accept that. But one last thing, sir, is there any way that any parent out there can figure it out from at a very early stage whether my child is epileptic or not, even when they haven't had a fit at all? do you think that there are ways that people can pick up that, God forbid, this might be a problem?
Not really.
Okay.
But if there is delays in walking and talking, like their developmental milestones are delayed,
Yep.
that can sometime lead to epilepsy.
Okay.
So these are the things, if there is concern, such concern of the parents, they should bring to the doctor.
Okay, wonderful.
Right.
Thank you
Thanks,
so much,
thanks
Dr.
so
Saab, for
much.
being with us. Lovely to
Thank
be
you
in
so much.
conversation with you. I think it was a wholesome program by far, where I think each and every one of us, by just talking about, epilepsy, that too with Dr. Saab, he was so good with his words that it was so understandable. So people, I guess it's a shared responsibility for all of us to be together and then, be with those people who unfortunately are not that well. And it's treatable, ladies and gentlemen. That's all that we really need to care for. Lesser stress, a little bit of jogging and walking, which is not actually kind of triggering you to kind of get fits as well. Please make sure that you do not drive. I think that's something which is not advisable as well. I've had a friend who was epileptic, and once he was in an accident because he got a fit while he was driving. So I think it's a shared responsibility of all the family members, all the people who are a part of our support system, to kind of make them live a better and a healthier life.
True. And with that, we are going on a short break, and after we come back, so they have a very interesting discussion lined up, and that too relating to the psychological effects on the young people nowadays. Don't go anywhere. Welcome back, and before going on to the break, as I alluded to the fact that we are going to talk about the psychological issues which are very much prevalent in the young people today, and there's lots of conversation on it, there are lots of discourses that are generated on it, and I'm really glad that there's lots of awareness surrounding it, because in the past these things used to happen, but they were so much bogged down in a lot of other things, in other problems that they were never discussed. So now we're going to talk about how there's a really prevalence of the mental health crisis across the world. It's not just Pakistan, and obviously Pakistan, being the part of the globalized world, is not immune to all of such sort of waves, or I would say psychological issues. So how to factor them out, how to talk about them, depression, anxiety, and what other factors could lead into them if they are left untreated or untalked about, and also the role of emotional regulation, which is very much important nowadays, because a lot of suppression of the emotion leads to I would say the proliferation of such sort of diseases. So to talk more about it, we are very glad that we have been joined by a consultant clinical psychologist. She happens to be Dr. Uzma Masroor. Assalamu alaikum, and thank you so much, Dr. Uzma, for coming here.
Thank you.
It's been a long time that you've been in our studios, but it's wonderful to have such an expert alongside us as well. And I think Hajis beautifully explained it in the first place. So let's start with that. So what happens is that when most of the time we're not expressing, we're keeping our emotions to ourselves. आप घर के बड़े हैं, किसी को बता ही नहीं सकते, सब आपको बता रहे हैं. Everybody's coming up to you. What do you think we need to do? Do you think, because most of the time we end up overthinking, not sharing it with anybody. आप अल्लाह से दुआ तो करें, you're praying to Allah, please,
We have our
how to
own
do the emotional regulation, basically.
Okay, starting from the emotional regulation, or just a little bit about the problems of the youth.
Start with emotional regulation, and then we will delve into
Okay. Generally, emotional regulation means just to handle your own emotions. We are not talking about controlling our emotions, but we are talking about the management of our emotions.
Right.
Because naturally, emotion is basically something very natural. It comes with you, I think. So this is a bodily response to any type of stressor or any situation around you.
True.
So you have to respond to every situation. Now the problem is, how do you respond to it?
But why do we have to respond? Do we have to recognize or respond?
I think there are the stages, because sometimes we immediately respond, because this is our, by default we have a response to the environment. For example, if there is some stress or threat in your environment, then immediately your body will respond to that. For example, if there is an uncertain situation, then you will start sweating and your heart start pounding. So basically this is your body response. So immediately, to save your life, the response is necessary and essential. But what happens later on, if we do not recognize the situation, if we do not identify the situation, and we are not aware of ourselves, like what we are going through, then the results are very, disturbing later on, because constantly staying in a situation that is unresolved would put you in a situation, either you are depressed or you are anxious.
So what should we do about it? So let's figure it out as well. Do you think that, going to your parents, talking about it, recognizing it, that there's this problem, Because most of the time you might not even have a solution to yourself. So what should we do? You know, do you think that it's better to go to an expert, be in conversation with somebody?
I think awareness is the word for that. For example, we need to be aware of the situation. You know, reflecting back is a mechanism that we can apply simply in a single statement. If I would like to share, reflect back mean once you were through some response or something. Later on, you can always think back. And you can evaluate what went wrong at that time. Was there any reaction from your side that wasn't suitable or that later on bothered you? Or was your reaction was unfavorable for your situation as well? So how did it affect the environment and situation? So constantly reflecting back. I won't say on each and every moment and everything, but try to be focused on something that you think is important.
But Dr. Uzma, you did sketch a scenario in which you said, for example, if there is a snake in front of you, obviously that is a very threatening situation.
Run.
Or you are going to run and
To save
your
your
body
life.
is going to respond to
Yeah.
you. You know, there is a dangerous situation out there and you need to take action. But what about the psychological impacts of there? So for example, people who are suffering from anxiety or depression, they have constantly the fear of unknown, right?
I know.
So this is not a situation that is in front of you in the form of the external stimuli, but you are maybe sketching it out in your mind, how to deal with that situation.
Let me clear it to you. Any situation that produces some sort of disturbing response is a situation that you need to work on.
Okay.
For example, you were supposed to present somewhere and there wasn't any proper response from your side. You were trying to,
Is overthinking a disturbing response?
Overthinking is something else, but I'm talking about a situation that puts you into something that you were not able to respond to that proper. For example, you weren't able to present. For example, there was an argument and you were supposed to contribute to that and you were not able to do that.
Or if you answered back, you said something which you were thinking about later on.
Later on,
I should have said that.
Then overthinking starts. Then overthinking starts. Like you were not able to respond appropriately or as per your own desires. Then what happens later on? You keep on thinking about that. मैं ऐसा कर लेता, मैं वैसा. So this type of overthinking that creates the anxiety, because then you start foreseeing the situation and you start preparing in your mind that how would you do that. So this is the point where you need to interfere with your functioning and in thinking, and you need to prepare a proper response.
And Dr. Saiba, is there any particular medicinal treatment for the anxiety? For example, what would you recommend? Because there is a CBT, cognitive behavioral therapy. When do you recommend you should go for the medicines or for the CBT?
Very, very important question. Yes, when your anxiety is too overwhelming that you are unable to continue with your day routine activities. Your mind is so overwhelmed and so over thinking that you are unable to focus or concentrate on your task. Or you have some bodily responses. Maybe you are some psychomotor retardation or constant palpitation or headaches. So you need to see a psychiatrist for proper medication. You know what medication does? Medication only supports you so that you take care of yourself. For example, your mind should be not that vulnerable, so you should be able to respond to your reality. And what a clinical psychologist would do, that he or she would start working with you in the form of like different interventions we have, like cognitive behavior therapy is one of them, in which we make the individual aware of their own cognitions, their overthinking. We try to work on overthinking. We try to, present them with different alternatives, some different behavioral reactions, some different coping mechanisms. So as a result of that, one is able to take control of their situation.
But with CBT, there was this other therapy, I think that we've talked about it earlier as well, where, when that therapy is given to a patient, what happens is that they forget a little bit about whatever was happening in their life. I don't know whether I'm correct on this or not.
Is this hypnosis you are talking about?
Probably.
So hypnosis is basically...
So to get rid of that one thing which is actually always making them vulnerable, does that really work?
Yeah, it may not work that well, but hypnosis is a phenomenon that is basically the professionals, they learn hypnosis. This is all about altered consciousness, to acquire the altered consciousness and to remove some part of your memory that may be not helpful for you. But I think 100% erasing some situation is not even possible. However, we can always reframe that into something that is useful for us.
All right. So, rather induce them with a good memory rather than them getting vulnerable to a memory which they think was traumatic.
It's
Yeah,
always better
they were
that you learn to regulate your thoughts out, because when thoughts become so much overpowering, that is where the problem of anxiety seep in. So Dr. Uzma, for the people who are very highly sensitive or who have empathic tendency in them, I mean, they are very vulnerable to anxiety attacks and all of these fluctuations in their mind. So what sort of, I mean, a walk-in routine you would recommend for them, especially if they are undergoing through
And anything with diet.
Yes, it has a lot with the diet. I think overall your your lifestyle matters a lot. Your time to sleep, your time to wake up, your highly functioning hours. What are those hours?
Right.
So anyways, despite, and although there is a lot of awareness, we can see how to manage anxiety, how not to be worried, this and that, still people are not continuously they are worried. The reason being that too much information is also not helpful. So first walk-in technique, I would suggest that do not go for each and everything that somebody suggests you, because that might be true for them for certain situation, not for you all the time.
Right.
So first thing is just to talk about that with a person who knows something about that. For example, you might know a counselor around, you may have some good, older relative or some friend or some cousin. So you can talk about your problems and learn from the other side that if they suggest you to change your routine, or talk about that, sometimes people have very good understanding. I believe there are a lot of psychologists, because I take advantage from them and I take help from them.
No, but talking with everyone is probably not advisable as well. Yeah, not with everyone. Every friend that you sit down, you're like, yeah, I'm going through this. But in addition to this, there's one more thing which just popped up in my mind, and that is that when we speak about talking to somebody, now most of the times what happens is that people are not really sensitive about your situation. Now imagine that, God forbid, if somebody was in an accident and unfortunately they broke their arm or leg, that's visible to people.
Exactly.
कि यार अच्छा चलो ठीक है, बाजू टूटी हुई है, टांग टूटी हुई है, and people will be there to help. Now for somebody who can look as normal as you are, right 10 hours before they've taken their life, people aren't able to realize that. Now, because then going to somebody who's not trained in it will certainly not be able to figure out what sort of emotions they're having as of now. So what would you recommend, whether to talk with everybody, whether always go to a professional, can always professionals be helpful as well or not, or rather when you have a heart connection? So, this is a very tricky thing over here.
So first you need to evaluate your own situation. If you think that you are able to manage, then do manage it. But if you think you are not able to manage, then you need to look for a professional.
तो इस चक्कर में मैंने कहते बेटा तू बड़ा है, लड़का है, बेटा तू ही करेगा, तो मैनेज ही हो रहा है बस.
This is not true. This is not true. जो बड़े वाला होता है ना, he has lot of emotions inside, because they have been told not to do so. So with the passage of time, when they grow older, around 50, they have lot of problems.
And if my father's watching, Abu, if you've got hypertension since when you were 25 years old, that's the reason. You were the bada as well, and then imagine that what you have done all through your life. He's never been sharing.
Exactly, bada should have some mechanism.
So what are some of the ways, Dr. Uzma, that you just, for example, Shahzad mentioned about the sharing, right? So how would you recommend it? Do you recommend journaling? Do you recommend, meditative practices, contemplation, or talking to people out there? And obviously, when you have anxiety, when you have depression, you are certainly very sensitive about who to share your problems with and who not to share with.
Because when you speak with your other half, the next day everybody knows about it. You're like, okay, this was supposed to be personal.
I think every activity can be helpful in some context. For example, if the problem is related to a larger group, for example, you have some issues with doing assignment, and lot of other people do have as well. So there is no harm in sharing things. Without relating to your personal stuff, it is okay to talk about something. So it also releases some sort of emotions inside, and you also learn what to do, because the other people would definitely share their own experiences. Sharing is very good. Secondly, you always have to try to find out a person who you can confide into. You can always go to, you should have a go-to person to you. Right. There could be a friend who definitely would never share information with anyone. And I think people, I think people are very vocal about emotions and their sensitivity. So I think this is the positive aspect of the society, that people have learned to keep the things confidential to everyone.
True.
Right.
What I've observed, remarkably, people have learned to keep the material to them because nahi usne bataya tha,
Yeah.
so I cannot share, I'm sorry.
Right.
So we can learn these practices.
Right.
So always go to a person who you can share, because sharing itself. When I started learning about psychology and started practicing about it, psychology, then what happened? People used to come, they used to talk about their experiences, their painful emotions, and they were settled. So I thought, what is this? So I
And then
didn't do
imagine
anything.
you being at the brunt of it as well, that you're listening to too many things.
Right.
It might
You
become
might
a problem for you too.
absorbing a lot of emotional trauma.
Yeah.
So how do you deal
It
with your
makes-
own emotions?
I
after-
don't know how would I answer that, but it makes me more understanding.
Oh, really?
Yeah, it makes me
Mashallah.
more understanding.
So,
Gotcha.
you can shield off and protect yourself while they're talking.
I
to you?
have a go-to person. That is why
Mashallah.
I have larger
Mashallah.
group where I can talk about my problems, and I have support from my family. So a lot of things do contribute.
And how
to
many
my
times
mental
do you
health.
think that talking about problems can actually solve your problem? Is it always the solution?
Yes, it does. You know
Always?
how? Yes.
100%?
100%. I'm
Okay.
telling you how.
Okay.
A human being is a reflective learner. When
Curious
you
being, yes.
when you talk about your problem and somebody is listening and you are talking over and over, then you have this solution click in your mind. Oh, I could have done this as well. Because speaking itself is a process of learning.
Right.
Okay.
Your intuition comes in.
Yes, intuition comes in, realization comes in, and a lot of understanding.
Right.
I'm amazed to learn the effects of, this repeated talking about something, and people sometimes they are, not happy about that. You constantly talk about one thing. I tell them that, talking about something over and over again would itself bring solutions.
Right.
True.
It will just layer them off, the consciousness, will go deeper, because re-experiencing, when you are sharing something, you are talking about something, you are re-experiencing it.
Right.
True.
So every experience would bring some helpful information for you.
Or probably, it can get you back into trouble as well.
No, I don't think so.
I think it would clear
I don't
out
think
your
so.
thoughts, and it
Yes.
would give you a more
It does.
How would you say it, a clear path towards it, and I think that is where your intuition comes in, and that is where your soul also is trying to talk to you into giving that aha moment. Okay, so I could have dealt with that thing in this manner. So so if when you talk about it, when you reflect upon it, or if you are journaling, because I journal a lot, I write a lot.
Yes, it also helps.
Yes.
Yeah, but I think that it's always going to be a different solution for people
Everybody.
with different
Yeah,
walks of
they're
life.
different.
For
So
me,
see what works for you.
yeah, for me it's more like, what I think to myself is that if I'm going to kind of speak about it again, probably it's just going to happen again as well. So I'm like, okay, just keep the words in rather than saying it. So even if I have shared it once, okay, that's fine. So I've shared it, somebody has told me, I'm going to go follow that as well. But God forbid if the same episode repeats, then I'm like, yeah, I shouldn't be talking about it more.
That's because your thoughts are very overpowering, and you need to reprogram and rewire your thoughts and tell them that this is not going to happen. You are going to find a solution.
I do that.
Take deep breaths, and then you will find a change.
One more thing, I always talk about the positive, reframing of your.
Yes.
For example, my son, he was going to university today, and he was saying, I'm so very emotionally overwhelmed. I said, why don't you say, I'm feeling challenged? So now, the life is more challenged
Words
for
are
me. Why do you
powerful.
think he said, I'm cognitively dissonance. I don't know what
And that's what I wanted to say, what Haja just spoke about as well. The words are really powerful. So we really need to be careful about what sort of words are coming out of our mouth.
Because don't say that you are ill. Just say that I am healing. When you say I am healing, then you are actually starting to believe in that, and then your subconscious will rewire your program.
And we all are healing.
Right?
That's it. I think that's the concept.
Yeah,
But thank you so much, Dr. Uzma,
Thank
for
you
being
so
with
much.
us. Lovely to be in
Thank you.
conversation with you.
Thank you so much.
And for everybody who's out there, ladies and gentlemen, let's continue with this process of healing all through the day and all through the week. A wonderful start to our Monday, alhamdulillah. And for everybody who's out there, please make sure that you write to us on our Facebook fan page, which is with the name of
Well This Morning.
on Twitter,
Well This
on
Morning.
Daily Motion and YouTube.
Well This Morning.
And the fabulous repeat is going to be at. Well, you got to check for that, ladies and gentlemen. Make sure that you stay tuned to PD World. Until next time, look after yourselves. It's a good morning.
Good
Let's see
morning.
you.